Medical Courier Connection podcast is brought to you by Key Software Systems. We believe that every delivery has a story, and it starts with you. That's why we built an ecosystem uniting accounting, delivery, tracking and shipping, reporting, and more to not only bring full delivery transparency to your customers, but to reduce errors and inefficiencies that stand in the way of over-delivering on your customer expectations. We'll drive the heavy lifting that keeps your business innovative with the latest technology so that you can focus on building connections with your customers.
Hey everybody, hey everybody, hey everybody, hey everybody, Ken with Integrity, Ken with Integrity, Ken with Integrity, Ken with Integrity Medical Courier Training.
We are providing on-site training in Roseville, Minnesota.
A man's digits turn blue due to too much cannabis use. A woman in Melbourne, Australia dies after being scratched by Minty, her cat. Stole the hearse and dumped the body on the side of the road, still strapped to the gurney, and then continued on with their joyride. A dog had to be put down after it was crushed by a package thrown over a garden fence, its owners claim. So, stay compliant, my friends. Get all your medical courier training needs from us at www.integritydelivers.com.
Welcome to the Medical Courier Connection podcast.
Hey, welcome, guys. Welcome. Hey, we are really honored to have a guest today on the Medical Courier Connection podcast. We've done about 15 of these now with different speakers, and Jerry is coming to us with such a wealth of knowledge, and I just thought, it's really important to have him come on and talk to our audience, and our audience has grown significantly over the last year and a half, 2 years now. And so we got a lot of new people checking the podcast out, and we're going to talk today about chemotherapy medications because a lot of people want to get into that industry, and they really need to know what they're dealing with. And so again, without further ado, I want to welcome you, Jerry, to the Medical Courier Connection podcast. How are you doing?
Hi, Ken. Thanks a lot. I appreciate the invitation, and always a good time of year to think about deliveries, couriers, and as we switch from snow to ice, I always say, and things can get a little tricky out there. So thanks. I'm glad to be on with you today.
Yeah, absolutely. Yeah. And so I wanted to say that, so we have, we've been doing training for 21 years now. We've trained, hospitals, laboratories, and courier companies literally around the world. I think I told you we flew to Singapore back in 2012 and provided training for a laboratory over there. And so we started putting more and more content on our platform so that people can sign in, get the training and certification that they need. And you graciously added your training class on the safe and proper transport of chemotherapy medications. And it got off to kind of a slow start. And not because of content or anything like that. It was just that we didn't have the traffic. And it's been almost 2 years ago now that some more influencers on TikTok started pushing people into our website, and the numbers started going up and going up and going up. And now it's extremely busy, and a lot of people are purchasing that course. As a matter of fact, your chemotherapy transport training course is the number 2 seller on our website, and so a lot of people want to get into this industry. But I thought we would talk a little bit today just about some of the risks and some of the benefits, some of the pluses and minuses, and so. If you wouldn't mind giving us an overview, first of all, your background, just a little snippet there, and then we'll talk a little bit about chemotherapy, medicine, and healthcare.
Okay. Well, I spent most of my career at the Ohio State University Medical Center and College of Pharmacy as the Senior Director of Pharmaceutical Sciences, and had a very large residency program and have graduated over 400 residents across the country, and also involved in the original development of the James Cancer Hospital. And after spending 40 years there, I retired and formed a consulting business. And one of our first big consults was with the Yale New Haven Hospital to help them develop the Smilo Cancer Network. Well, the goal there was to move from an inpatient setting to a care center setting where we had 16 different sites for cancer care to bring cancer closer to home. And in doing that, we actually had to sometimes make the chemotherapy and deliver it between all those sites, and had to do that safely. And sometimes these sites did not make their own chemo, so we had to actually train and hire couriers to make those transports in a safe manner on a kind of a more permanent basis. That's kind of when I met Ken, and we said, well, do people know how to do that? And I said, absolutely not. They really don't know what they're doing. They're not trained to do it, and they don't really even understand what a hazardous drug is. So I'll pause for a second and then really need to define what is, in fact, a hazardous drug.
Yeah.
The NIOSH, which is the National Institute for Occupational Safety and Health, really makes this definition in drugs that are taken by humans as any drug that can be carcinogenic, teratogenic, can impact your reproductive health, can also have an impact on, or have genotoxic effects. Those are really the four big categories. So it's not always just chemotherapy or what we call anti-neoplastic drugs. It can be drugs that can be used in cancer care, but wouldn't necessarily be considered neoplastic drugs, can also be hazardous. And sometimes people get confused between what's a hazardous drug or a high-risk drug and what's a cancer drug. And from a courier perspective, it's what do I need to do to be cautious and protect myself? Well, it wasn't until fairly recently that the United States Pharmacopoeia, USP 800, came out, which was really designed to protect you as the healthcare worker. The other chapters, USP 795 and 797, are really designed to protect the product and how to make it sterile, or if it's non-sterile product, how to make it properly. But USP 800 was really designed on how, if I'm handling hazardous drugs, how do I do it safely? And then OSHA adopted USP 800 as their mantra for what do we do if something goes wrong. Okay. So that kind of reminds me of Ken and I talk about, what are some of these things that can go wrong sometimes? And right. I think I'll start off with one of my favorite stories where we had a courier system set up that there was supposed to be a delivery every hour from the main hospital to a satellite hospital. And we allowed for about 40 minutes transit time, and so they would get good turnaround time. And I noticed that one of the couriers was getting there in 20 minutes every time. And I said, wow, this guy's going to get speeding tickets, or he has a new route or something. And I asked him, I said, are you taking the route that we had mapped out for you? And he goes, yeah. I said, well, how are you getting here? There's traffic throughout the day, and how are you always getting here faster than anybody else? Well, he explained to me that his car had broken down, which he was using for his courier business, and he didn't have the money to pay for it, so he decided to use his motorcycle. So he would just take the box that contained the chemotherapy and strap it on his motorcycle and then weave in and out of traffic. And we said, oh, this is so much faster. And I said, so what happens if you have an accident, or if the motorcycle tips over and the box spills? And he says, well, I did go through that spill kit training that you trained me on. And I said, yeah, that's for accidents, not for things that you bring on yourself. So I said, a motorcycle is not a good vehicle to transport hazardous drugs. So we kind of put an end to that. But he really thought he was doing a great job by using his motorbike to transport. Maybe good for pizzas, not good for hazardous drugs.
When I went to Singapore and provided training for the lab out there, they had motorcycles that their couriers were using to transport lab specimens. I mean, it's a different climate, a different country, different standards, but there was one particular courier that had that plastic saddlebag on the back of his motorcycle. and he didn't lock it properly, and he's driving down the highway and lab specimens are flying out behind him. Well, he doesn't know. And so there was specimens littered all the way down this highway on his route. And a lot of couriers don't always think about the process so much. They should, especially when it comes to chemotherapy meds. They really need to think about the process, because if they mess it up, it could be their life and health. I shared another story with you previously about when Linda and I hosted the Medical Transportation Summit years ago. It was a 3 years in a row. We hosted a conference for medical couriers. We brought in speakers in different medical specialties and courier companies to work together and just network and learn. But this one particular pharmacy had a representative there who was a supervisor of the courier department, and he was transporting a bag of chemotherapy medication. And I got to say, it was single bagged, if I remember, because I actually did services for that pharmacy years ago. And I think that the package they were single bagging the medication. And at any rate, he's got a box in his hand. He's got the bag of medications in his hand. He's got his car keys, and he's walking to the car. The bag got punctured, and some of the powder got on his hand, and then he wiped it on his pants leg, and then he put his keys in his mouth to free up a hand. And shortly thereafter, his tongue started to swell up and crack as a result of that. But, couriers have to think about what they're doing, because there is definite risk. What can be some of the dangers of an exposure like that to a courier?
Well, there's short-term exposures. Like you said, you could have a rash, you can have swelling, you can have irritation, any kind of skin contact, whether it's with the mucous membranes like your mouth, or if it's just intact skin. Any chemotherapy can be an irritant on the short-term basis. On a long-term basis, exposure to chemotherapy could actually lead to cancer. Wow. Or to, I said, teratogens, it could affect the growth and well-being of a baby. It could also impact your reproductive health. You may not be able to reproduce properly. So there's lots of things on a long-term exposures. Mm-hmm. But short-term exposures, like I said, normally you'll see conjunctivitis, or your eyes will swell up, or irritation, depending on the type of exposure it is. Mm-hmm. And like I said, sometimes people just don't think. I just recently, the past few months actually, did a consult for a hospital I care not to name for their protection.
Okay, yeah.
But it was in the South, and they had a problem with one of their main chemotherapy hood had been knocked out because of a storm. And so until it was going to be repaired, they really needed to go to another hospital that was about a 20-minute walk away within their system. So they would get the chemotherapy and put it in, again, a single Ziploc bag, not even double bag, and walk it over to the other hospital and then bring it in to repair it. So I asked if I could walk along to see the route. And in that 20-minute walk, I can't tell you how many streets they had to cross, cracked roads, up and down stairwells, and so forth. There had to be 20 trip hazards, as I would call them. And I said, do you have a spill kit with you? Oh, no, I wouldn't be able to carry a spill kit because I've already got this. And I said, and you've got your big drink, and you've got your cell phone, and cigarettes if they could. But they had so much going on. So the whole time they're walking, they're on the phone and sipping and drinking and moving the bag around from arm to arm. And I've just said, this is a disaster waiting to happen. So the first thing I did for them is said, you, number one, have to get a golf cart and a courier that's trained to deal with spills, and a box on the cart so that you're transporting. A 20-minute walk is not short. So we can cut the 20 minutes down to less than 5 minutes, number one, be transported by a professional who understands what transporting is, get the specimens double bagged, put them in a proper container, hand them to the courier who has a spill kit on the golf cart at all times and then do this transport properly. So, but they never even thought of the risk. I said, what if you tripped, broke, got hit by a car? Any of these things are bad. You have very hazardous, highly toxic drugs with you. And what are you going to do? You don't even have a way to call for help. Well, that's not true. They had their cell phone.
Right.
So,
yeah.
But in the meantime, they didn't have a way to block it off, clean it up, anything at all. So all that had to change. And that was day one at this consult.
Wow. Yeah, it's interesting. When you're a consultant and you go into a medical facility, you're a different set of eyes. You see things that they might not be noticing on a daily basis, stuff that's always been this way. But you come in with a fresh set of eyes and you're like, well, that's a violation, and that's a violation, and that's a violation.
Right.
And I was in a hospital in Mississippi several years ago, and there were several things that popped up that I had to point out. You guys got to fix this. You can't do this. If you get audited, there will be fines. You cannot do this. And all I could do is make my recommendation. I made it verbally and I wrote it down. I have no idea if they implemented the changes. So they didn't call me back the second year. So, but the couriers, we see people on social media, and a lot of young people are getting into the medical courier field, and they're really excited about it. They're really zealous about it. And it's really money drives their focus. What's the best paying route I can get? What's the best paying work I can get? They take your course, which is a real eye opener, and I hope that they're not distracted when they take the course, because you talk about very real risks. If there's a leak or a spill, and how to handle that, how to deal with it. But if they just breeze through it to get their certificate, that can be really concerning. So I don't know. I appreciate that you've partnered with us to offer this, because people need to know what it is that they're handling and transporting and what the risks are, truly are. So
go ahead.
Go ahead. No, go ahead.
There's changes that have occurred a lot, because you probably see TV commercials all the time for products like Keytruda, products like they're on the TV all the time, but those are not actually chemotherapy. Those are called immunomodulators.
Okay.
And so they're not listed as hazardous by the NIOSH list. So the NIOSH list, I printed it out today just for the sake of it. It's 40 pages long. And of course, you can get it in an app, but you want to really look up and see, is that a drug in category 1, table 1, which has manufacturer's recommendations for handling? Or is it a category 2, table 2 drug that may have some hazards, but you don't have to handle them the same way? Definitely, you kind of need to know what those are. And some people get mixed up. I'm going to use methotrexate as an example, which can be used for leukemia. And it can also be used for acne. Okay. So if a dermatologist writes for methotrexate for acne, you can pick it up at the local drugstore, and it doesn't make it less hazardous just because of how you're using it. And so it also can be compounded into a liquid, which is how children sometimes take it. So it may be delivered to your house as a liquid. And when you crush these pills up, the hazardous drug goes like everywhere unless you know how to contain it. The one thing that a lot of people don't realize too is almost every vial of chemotherapy you get has residue of the chemotherapy on the outside of the vial, not just on the inside of the vial. So when we receive these drugs from the wholesaler or the manufacturer, the first thing we do is open them under negative pressure and wipe them down to get rid of that residue. And of course, we're handling it with rubber gloves and so forth. But that's not always the case. And so I can see people picking up, like even in the drugstore, a bottle of methotrexate. The outside of that bottle has probably got lots of methotrexate on it.
Wow.
And you don't even realize that. So When, as a courier, you go to pick something up, it should be in a double bagged in Ziploc, for example, and then inside another box that should be marked as hazardous. There should be no reason ever that you need to open that box to inspect things, but you should have what we call a bill of lading to know what it is you're transporting and whether or not it needs to be refrigerated and what conditions and if there's ice packs and so forth. But those are all important things to do and to know. That's a good example of a typical styrofoam box. I've used some like that. I've used plastic ones, but they do need to be labeled appropriately. And so that, and also, do they have to be kept upright? What if, some people will take a box like that and lay it on its side and then the lid falls off. So you don't want to do that either. That does remind me of another story, Ken, of a courier that thought, well, instead of putting it in a secured area in the trunk, I'll just put it in the passenger compartment and strap it in like it's a passenger. Well, of course, that activates the airbag. And so if you have an accident, that airbag's going to, activate and probably blow that little styrofoam box into a million pieces. So that's definitely not where you want to put that box. You think you're strapping it in to protect it. You're actually strapping it in harm's way.
Oh, yeah. Yeah. And again, most couriers, aren't going to see that risk. But so I was in California speaking recently at a holiday party for a large company that's a client of mine. And they took me to one of their sites to meet their clients, which is something I love to do. And one of their drivers was coming out of that facility with a little two-wheel dolly with a styrofoam container on it. And we walked up to him and said, "Hey, so-and-so, how you doing?" And I said, "Hey, what you got in that styrofoam container?" And he goes, "Oh, it's chemo medicine." And I turned to my hosts and I said, has this guy been through the training? And they said, "No." And so we had to, and it was like, how long has he been doing this? Well, twice a week for months. And so we had to remedy that. But it's interesting when you get some courier companies with multitudes of couriers that are servicing medical facilities, sometimes the area managers aren't completely aware of what's going on and what's being transported.
Yeah. The other thing that to be cautious about, if you've heard about HIPAA, which is the Privacy Protection Act. Mm-hmm. Well, almost all those bags are going to have the patient's names on them. Mm-hmm. And so even exposure of the names to people that are not involved in the care of the patient is a violation of HIPAA. Right. And so, when I said, if it's put in that box and you have no reason to open that by reading the patient's name, is you're to deliver the package, not to know who it's for. And so HIPAA violations are sometimes subtle. You don't really realize it. And if you just take that bag, for example, and with the patient's name on it, and say it's Ken Arnold, and it says Ken Arnold's chemotherapy for pancreatic cancer. There's a lot of information in that just by laying that out. And then the entire nursing unit has seen that and knows that. And it really only should be for the specific people taking care of Ken Arnold. And so you have to be very careful about a violation of HIPAA when you're moving around. It's not only the drug, but medical information as well.
Right. Absolutely. Yeah, we do have a HIPAA compliance course that is courier specific that a lot of people go through as well. First of all, who makes chemotherapy medications? Is it hospitals that create it, or are there specific pharmacies that make it, create it, and then distribute it? Who makes it?
Okay. Well, there's about 10 large companies that manufacture the chemo. And I'd say those 10 large companies make up probably 80% of all the chemo. And then smaller companies maybe another 100 companies may make up the other 20%. And they'll deliver the chemotherapy to you in, say, in the hospital in nowadays it has to be marked and double bagged and so forth. It never used to be. It was always just mixed in with other stuff. But with USP 800, it's required to be separated. It's usually marked in yellow or red containers. And then when it's delivered, it's opened up in a negative pressure room after you've had the chance to wear protective garb and gloves and so forth. But those 10 companies are the ones. I think Roche is still, Hoffman-La Roche is number one. They have probably 30% of the chemo market. Do a lot. Lung cancer is still number one, and they make lung cancer drugs. Celgene is number two now, but their biggest product, I think, is Revlimid, which is for multiple myeloma. But even though it's like a very big drug, it's not a hazardous drug. So it is a anti-neoplastic drug, but we could handle that without worry about hazard because it's an immunomodulator drug. And so that's where you have to first, the hospitals go through and say, how do we handle this? Are these drugs that are handled as hazardous drugs or non-hazardous drugs because it impacts storage, delivery, and so forth? And just because a drug is used to treat cancer doesn't mean that it's a hazardous drug, because there are now so many new drugs, we call them monoclonal antibodies and immunomodulators that are very, very powerful anti-cancer drugs, but they're not hazardous drugs. And that can be really confusing. The names of the drugs, for example, are very confusing. So, and how they're handled. So one of the, to give you an example, there's a drug called rituximab. And it's very well known, and it's used in combination with other drugs quite often. It in itself is not a hazardous drug. But I see that a lot of clinics or a lot of hospitals will treat it as a hazardous drug just because it's part of the regimen. And so it's patients get confused too. If I came out and I said, okay, I'm going to give you your non-Hodgkin's lymphoma drugs, and 3 of them are hazardous, but the 4th one isn't. And so I'm not garbed for this one, but I'm garbed for that one. And it's so confusing that I said, okay, we'll just treat it as a hazardous drug and just treat everything the same, even though it's not technically a hazardous drug. Well, we've had to rethink that a little bit because hazardous garbing is very expensive. And so let's say on day 1, I treated that, but rituximab I give for the next 3 to 4 days. And there's no reason actually to garb for that. So I think it's best to just be honest with people and tell them this is exactly what this thing is. And, you know, we were already garbed this day, so that's why we did it. And on the next 3 days, we don't have to because it in itself is not a hazardous drug. I'm handling it without gloves, and there's nothing to worry about as well. So that's what we waited almost 10 years for the new NIOSH report to come out. So it just came out in 2024 and kind of resorted all these things. There used to be 3 categories, and now there's 2. And in the 2, and they move things around so that it's easier. It is either hazardous to humans or it's not hazardous to humans. Even though it may or may not treat cancer, is not always the defining issue. But the hospital will determine that. And when they put that sticker on there that says it's hazardous, then trust me, it is, because they don't want to put it on if they don't have to. But
that
once
makes
they
sense.
do, you have to treat it that way.
Yeah. So, you know, there are things, you know, hazards that we talk about in our bloodborne pathogen training, understanding, you know, that there are regulations, and there are new regulations on transporting contaminated instruments, for example. You know, bloody smocks, lab coats, things like that, bags of needles. These are all things that we talk about in our training. And I always put the onus on the facility. It is the facility's responsibility to package this and to label it properly. And so the couriers get in this mindset of just going in and picking something up and delivering it because it's there and they're required to do it. But at some point, they've got to be aware of the labeling, the color coding scheme. They've got to be aware of what it is they're picking up. and get past that mindset of just don't ask questions, just go there and pick it up. Because when it comes to chemotherapy or hazardous drugs in general, you talked about there's such a variant. Different diseases are treated by different medications, and these are hazardous and these are not. If the facility isn't doing due diligence, and we all know that there are some facilities around the country that may not have the proper protocols in place, that's why they're audited, and that's why they, suffer fines and things like that. And so couriers are going in here not knowing any different. They're not knowing the difference. They're trusting the facility to hash that out. It seems like this is a bit of a minefield.
Yeah.
In some cases.
Yeah. And one of the things is we don't expect the courier to make the determination of whether something's hazardous or not. That's not their responsibility.
Yeah, thankfully, yes.
When they sign for the package, though, they're signing two things. They're signing that they've picked it up, it's now in their custody. And the second thing they're signing for is, has it been packaged properly? And so if I was going in and I said, okay, I'm here, this is the time, but it's not packaged properly. It's loose, the container's cracked, it's not, doesn't have the hazardous stickers on it, all those types of things, then there's no reason for you to sign it because it's taken custody. I always look at things like the library. If they, libraries still exist. And if you take out a library book, it's deemed to be in a certain condition. If you bring it back and it's not in the same condition, guess what happens? You pay a fine or a penalty, or you may have to pay for the whole book. Well, if I pick up a package and now I deliver it, and I've already signed, it's like a rental car. I've signed that it's in good condition, and now I deliver it and it's crushed or destroyed or broken, and then they open it up and see the contents are, guess who was responsible for that? Okay. Now, you may not have known whether it was crushed material when they put it in there, but, if you're still going to be associated with that when you deliver it, because we always ask the nurses to say, inspect the package before the courier goes, because once the courier goes, it's now their responsibility. So that's all part of what we call chain of custody. What if they open it up and there's nothing in there? That's why we like to use tamper tell. Sometimes it's tape, sometimes it's those tabs that can only be opened once, and so on and so forth. So I do like to use tamper tell packaging as well, so that that the person is there. Have you seen anywhere where they're using biometrics, Ken?
As far as lab specimens go?
Or anything in the transport business? Because I've been amazed. I travel a lot and I go through the airport, and Clear is a way that you can get through the airport faster. Well, they've improved their technology now to include facial recognition. It used to be fingerprints, and then it went to retina scans, and now it's total instant facial recognition. It's so easy to do. And so I just was wondering if in some state in the future, we may have courier facial recognition so that the right person is picking up the package as well. Because I don't really know that the person picking up the package is legit.
Yeah, no, I have not seen that widespread. I just remember the protocols when the COVID lockdowns happened. I flew to several cities and did training during the COVID lockdowns, and the hospitals were instituting protocols as far as infection control goes. But no, I have not seen that protocol used in courier work as of yet. Doesn't mean they won't do it. I mean, there's all sorts of chatter about drones and other technologies increasing. The bigger concerns, I think, right now for courier companies is providing a tracking system, the ability to barcode and scan, giving tracking and visibility to the hospital or facility to be able to know where their specimen is going, and when it gets there and when it's signed for.
Yeah, so, I think have you seen RFID tracking then, where they can actually put a trackable chip in the box or anything like that?
Well, yeah, a little bit, sure. Yeah, I mean, there's I can think of one company, Akira Temp, I believe, does that. We've been talking with them a little bit, but it's not widespread. Not a lot of them day in and day out specimen handling and transport. courier companies, mostly, again, tracking for visibility, scanning when you picked it up, scanning when you dropped it off, scanning if there was no one there and the specimens weren't left out. Because these apps now, as a matter of fact, we're going to be having in a week from, or actually on May 9th, we've got a software company coming onto our podcast. We'll be talking about that, about what's coming up, what is the most popular, what's the most, needed or required technology. It's interesting. I did an article a couple of years ago where I interviewed several people in different medical specialties about what was important to them, and that tracking and that visibility was really important, especially for samples, because of lost lab samples. And one gal that I remember specifically was pining about the possibility of, we'd like to get some kind of a microchip on every tube, so we know when the blood is drawn, we know when it's bagged, we know when it's being moved from the facility, we know when, as it's driving along, we know when it gets there and when it gets handed off, and then we'll also have visibility to see it while it's in the lab. A lot of lab specimens actually disappear once they get to the lab. Yeah. So that nanotechnology would be maybe attached to a tube or something like that. We're not there yet, but I could definitely see that coming in the future as well.
Yeah, I can see that. I mean, the closest we've come to that is a lot of chemotherapy is temperature sensitive, and especially with USP 800, depending on how it's made or where it's made, it may only have a 12-hour shelf life. And some only have a 4-hour shelf life. So if I'm transporting them, I also have to make sure that it doesn't go out of temperature range. So lots of times we'll put in, there's simple things like Tempa dots, and they'll change color from green to red if there's a temperature excursion. So in the summertime, once again, if you park your car and the specimen or the chemo's in the trunk, that trunk temperature can get pretty high.
You bet.
Even though we do always have cold packs and so forth. If it's delivered and the temp dots turned red, we know that something's gone awry. So we already do that. I just was wondering, trying to project 10 years out from now, what we might be seeing.
It'll be interesting. They what is the saying? Everything that we can know will be doubled in every 7 years. I'll bet it's down to more like 2 or 3 years. So, technology is changing so fast. And so I'm sure there'll be some of that coming down the pike. Let me ask you a couple of questions.
Sure.
What if somebody ruins a chemotherapy med in transit? So we're kind of on that path right now, talking about it. What happens? Who gets involved? What's the regulatory agency that's going to investigate? And are there fines and penalties? And who enforces those fines and penalties? And have you even seen some, those situations?
It's pretty rare. Delays are probably the biggest issues because of traffic. Sure. I worked a lot in the Northeast corridor where you can have killer traffic jams. One wreck on a bridge highway, can be backed up. So delays have been problematic sometimes, where something's had to be made a second time and delivered. Haven't really seen too many punctures, but we do see spills from time to time. The spills are rarely with the courier, though. The spills are after the package is delivered and somebody rushes to grab something, and then they break it on their way to the inside or outside of the place where they're making it. And then, so you have those types of situations. It's also important that you have more than one person in the facility trained in spill kits, for example, because like I said, if something bad can happen, it will. We had a situation where the person who actually dropped the chemo vial and spilled it was not the person that was going to make it because she was pregnant. So she wasn't allowed to make the chemo. So all she was supposed to do is take that bag and deliver it inside the hood, and she dropped it. But she also was the only person that was trained in spill kit. So I said, well, she shouldn't have been in there in the first place. But I said, well, smartly, they didn't make her do the cleanup. but because she was trained, she was able to take somebody and guide them through the process. But sometimes a place will say, oh, well, instead of taking everybody through the training, they just trained one person. But the one person they trained wasn't really capable of doing it because of her situation.
Right.
But technicians are hard to come by. It's not, there's always a technician shortage. And so, like I said, when somebody gets pregnant, they can't make the chemo, but they'll still have them do whatever they can do and try to avoid things. But this was a pretty tight situation.
Interesting. So you, in a previous webinar that we did a couple of years ago, you talked about what are the ramifications if somebody was to drop it? What are the possibilities if it gets on their shoes? Where does it go from there? What are the risks? Can you talk about that for a little bit?
Well, the first thing happens when there's a spill is called containment. Mm-hmm. So you want to contain the spill in as small a possible area as you can. So the spill kit contains like spongy types of things to soak up as much as you can. And the second thing is to decontaminate it. So water will dilute it, but it won't decontaminate it. But there are specific chemicals that will actually decontaminate the product. Now, there are certain products, you mentioned shoes. Are they canvas shoes, leather shoes? How far did they soak in? Are the shoes salvageable? First thing you do is get out of the shoes. Okay.
Yeah.
So then they'll keep wearing the shoes that are covered with chemo. And then I've got to decide, are these shoes salvageable? Can I decontaminate them appropriately? How big was the spill? But the shoes may be lost depending on what the chemo is. And, adriamycin is a good example because it's red dye colored and you can see whether or not you got rid of it or not. But most chemotherapy is clear. And so you really can't tell unless you test it. So there are tests that you can do to determine what the level of chemo is, residual chemo. And if it's still high, then you can't use it. If it's below a safe level, then you're probably okay. But it would have to go through a number of cleaning steps. Alcohol does not decontaminate. A lot of people think, oh, wipe it off with alcohol. That's a sterilizing agent, but it doesn't decontaminate. But things that do decontaminate, like hydrogen peroxide, can also be pretty harsh on your shoes too. So your shoes may not, they may be decontaminated, but not wearable. But they'd look pretty funny sometimes with some of the decontaminating agents, bleach and hydrogen peroxide. And there's just, some pretty harsh chemicals that you have to use for decontamination. But the first and foremost thing is to cordon off the area, make sure that people don't walk through it, and to you kind of treat it like a crime scene. We actually put up cones and put tape around it and make sure that area is really defined. And then you actually contain it and absorb everything you can, dilute it or decontaminate it. But imagine this is in the street or this is on the sidewalk. Let's say you had a spill in downtown Manhattan. That would be quite a work to try to cordon off that area.
Right.
So those are some.
Can those microns become airborne at any point, or are they heavier?
Most of them are not. There are one or two chemotherapy agents that are considered volatile, but the majority are not. That's why, however, when we do the chemo cleanup, we wear a mask and we wear goggles because you don't want anything to splash in your eyes or inhale. But the good news is there are very few. There are some, but there are very few that are really volatile, that are aerosolized. But you don't want to make that happen too by, you don't want to take a whisk broom and start, whisking things in the air. And, but that's why you want to really keep things absorbed and low down and be very slow and cautious in the way you clean things up. That's all part of the spill kit training.
Yeah, I mean, absolutely. When you're talking about transporting, lab specimens or chemotherapy, medicine, hazardous drugs, you have to be trained My biggest problem was, first of all, that the gentleman that we ran into was an employee. Even if he wasn't, if he's transporting hazardous materials, he has to be trained. Needs to be awareness training, function-specific training, security training, and this driver had received no training in it, and he's just off, putting it on the dolly and leaving the building and going to his car and delivering it. And so, it's so important. And so a lot of people, like I said, a lot of people are taking the training program. They're now very aware of it. And hopefully we don't have any incidences where people need to, but accidents happen. Accidents happen. And that's why we call them accidents. Let's see here. Hang on one second.
I have a quick question for you while you're looking. I was in South Africa last summer, and one thing I found that was very popular, and I actually had to use it twice, was called Uber package delivery.
Oh my.
And they get these tiny little cars that are really too small for human use. And for a very low rate, the Uber package pickup will go. And I actually left my big long range camera at the Airbnb that we were at. And it would have cost me probably $100 each way to Uber back to the site. Yes. But I used the Uber package delivery for like $25. And so for just the one-way delivery. So I started thinking about, I wonder if people would use Uber package delivery for courier service. Because the Uber drivers are not trained to do anything,
Right.
And so that could be really a risk if we got into people saying, hey, I need this chemotherapy delivered to this patient. I'll just send it by Uber. That'd be pretty scary.
We did hear about that with pharmaceuticals. DoorDash is actually delivering pharmaceuticals now.
Is that right?
We had heard
DoorDash
about that
drugs?
6 months ago,
they call
maybe
it
a year
DDD.
ago. Yeah, exactly.
Yeah, DDD.
Yep.
Well, yeah, and Uber does have a medical division, and they are doing some of that. And I mean, Amazon does pharmaceutical deliveries now, so I remember we had a pharmacy client here in Colorado Springs several years ago. My wife and I were on our anniversary, and we got an emergency phone call from the pharmacy saying, we need you to deliver a package from Colorado Springs to the other side of the mountains. UPS was transporting these medications, several vials of very critical medication, and they smashed the box.
Oh, Lord.
It was destroyed, and the medication was destroyed. They needed it now. So we had our son at the time bring us the box where we were enjoying our anniversary. We canceled our reservations at the nice hotel we stayed at. We drove for 6 hours to the other side of the state, delivered the medications, and stayed at a Motel 6. And I'll never forget it. But so there's a lot of people getting into the industry. What would be your best advice for those seeking work within a pharmaceutical setting as an independent contractor or courier company servicing this sector, the chemotherapy sector? What would be your best advice for them?
Well, best advice is to find out, have a reliable vehicle. That's pretty important.
Yeah.
Understand that there are potential risks involved and get trained. I actually had one person I was training get up in the middle of the training and say, thank you for letting me know that this is a risk, but I'm not willing to take the risk, so I'm leaving now.
Yeah.
And everybody kind of looked at him and he says, that's perfectly within his right. Nobody's forcing him to do this.
Yes.
But everybody else said, thank you for training. I know exactly what I'm getting into. Thank you for educating me. And I feel much better that I know that I'm picking up a package and how to protect myself. So training is essential. Reliable vehicle is essential. And then know the routing and be comfortable that you can make that route and that you can be a reliable person too. So not only the car has to be reliable, we're relying on you as an individual to show up for work every day because these are life-saving medications. Kind of the last little link to that is years and years ago, it was in the 70s, Ken, I think we had a kidney transplant patient that got their kidney transplant at Ohio State. And then actually went home to Erie, Pennsylvania, and they did not have enough of a certain medication. If they didn't get it, their kidney would have rejected.
Yeah.
And there was no local pharmacy to get it. They had to get it from us, and we couldn't figure out how to get it to them quickly enough. And so I actually called the highway patrol and asked the highway patrol if they could run it there from patrolman to patrolman up the interstate highway and get it to Erie. And they did within hours once they realized it was a life-saving thing. So it's kind of like no Motel 6 involved, but the highway patrol was my lifeline then. But I think those are the most important things, is that patients that receive this medication, this is their lifeline. And so it's not really a job that you have as a courier. You're part of the healthcare system, and a very important part of the healthcare system. So I think that's the main thing. So the more what's the name of the company, Ken? Integrity.
Integrity.
That's what you need to have, is you have to have integrity, reliability, and honesty if something goes wrong. So as long as you have that, you'll have business for a long time, because unfortunately, my good friend Dr. Arthur James built the James Cancer Hospital hoping that it would go out of business, that cancer would be cured, but we're nowhere close to that, unfortunately.
Nowhere close. Yeah, that was going to be my next question. Where do you see the industry going? Where do you see, as far as the battle against cancer? I mean, we hear about all sorts of therapies that are coming up. I mean, during COVID, people were talking about, was it bendazimab or whatever it's called? I can't pronounce it.
Ivermectin?
Ivermectin.
Ivermectin was the fish poison, right?
Yep. And there was another one. It was at any rate. So, people are. I mean, the internet is full of information, and some of it's good and some of it's not so great. A lot of people say that a combination of that horse tranquilizer with the, ivermectin and other things is an absolute cure to cancer, and people have their testimonies, and it worked for me and all of this. But what do you see coming down the pike? I mean, are we going to stick? Is chemotherapy? Is it that horse that we've got to ride on and keep riding? Are there any promising possibilities in the future where we may move away from, chemotherapy meds necessarily?
Well, we're seeing more targeted chemotherapy because we are learning more and more about genetics. And so the more we know about genetics, we can know in advance whether something may or may not work.
Sure.
And so you always hear, even in breast cancer, are you triple positive or triple negative? And people say, oh, I'm triple negative. I go, that's worse. I said, why? I said, because you can't target anything if it's triple negative. And so understanding genetics we're getting much better at that. Actually, because of COVID, the big question with COVID is, why within one family did one person die, one person got sick, and two people didn't get sick at all, and they all had the same exposure? Yeah. That's genetics. And so we're finding out more and more every day. And I think that'll be the key to everything is, now, can we fix your genes? That's pretty far future, but there are some gene splicings. There are some gene therapies that may permanently cure you. Remember, chemotherapy is pretty rude. It's selective poisoning, and we hope to kill the tumor before we kill you. And sometimes it's pretty close. Immunomodulation allows your immune system to fight back. And sometimes you don't need the chemotherapy at all. Radiation therapy is really harsh because we're targeting a certain area, but major side effects. So I think radiation may be less. Immunomodulation definitely is going to be greater. What it means for the courier business is that we have more patients being treated remotely from the hospital, in smaller clinics, or at home. And so delivery of medications to these clinics and to home will be more and more common. Being treated in the big hospital will be the rarity. Diagnosis in the hospital will be the norm. Treatment in the hospital has continued to decrease and will continue to decrease, not only because it's not necessary, but it's also less expensive. And
Right.
so I can see in the future a much, where I worked at Yale was a good example. When we went there in 2010, there was one main hospital with one clinic. And we did a consult there that lasted almost 16 years. But when we were done, we had almost 19 centers to treat people at throughout the entire state. And our motto was bring cancer care close to home. Don't have to go more than 10 miles and free parking. So we
Yeah.
built these centers all over, and we were connected by at first only by visual and auditory, and then finally put some people in there. But we didn't let the lack of people hold us back. And so we had quite a delivery network going out because of that. And that expansion made it so much easier. You may have had to come into Yale New Haven Hospital for your big workup and diagnosis and all the MRIs and the different kind of PET scans and all that stuff. But now that we know how to treat you, we can do that, closer to home and make cancer just something that you have, not everything that you have. So I can kind of see that going on, but having a good delivery network is important as well. So I find this very important because, as you and I both know, a lot of things can go wrong, a lot of things do go wrong, and a lot of things will go wrong. And our way of dealing with that is education. So I thank you for inviting me to come on today, and thank you for all the good work you do.
Jerry, thank you. We sure appreciate our relationship with you, and you've brought some real quality to our library of courses that we offer and training options that we offer. And at the very least, hundreds and hundreds of couriers out there taking your course, learning about the dangers and the risks, and then they're adults. They get the opportunity to do this safely and effectively and have that positive impact on the delivery of excellent patient care. And that's everything. Right. So we will be coming out to Ohio again this year, I do believe, and I will let you know when we do. And we'd like to take you out to lunch when we're there. So I'll let you know way ahead of time, and hopefully we'll get to do that. So, well, Jerry, I want to thank you, man. This has been great, so eye-opening, and as always, we will be in touch. And thank you for putting your course and helping couriers learn about the possible risks of doing these deliveries, but the importance of it as well. And we'll hopefully have you on sometime again in the future. As always, let us know of any updates, the regulations, or any changes we need to make in the program. But again, Jerry, thank you so much. We appreciate it.
Yeah, thanks. You're welcome. And we'll be in touch. Linda's asked me to look at a few other things, so we're going to try and do that.
Yeah.
Very good. Thank you. That's a wrap. Chris, go ahead and run the outro.
Yeah. You can find our podcasts on Apple Podcasts, the Podbean app, Spotify, Amazon Music, iHeartRadio, Player FM, and Podchaser. And of course, you can watch it here on YouTube. Don't forget to subscribe to the channel, like the video, share it around, and leave a comment. Let us know what you thought of the episode. Yeah. And shout out to Key Software Systems, our sponsor. We love having them on board.
Yeah, absolutely. Hey everybody, Ken with Integrity Medical Courier Training here.
And this is what's happening, right? So with such a serious subject, but he's able to inject humor.
Take a look.
How long I've been waiting for this. Ooh, I'm about to make a name for myself, yeah.
I'm a medical courier. Of course I know how to use a spill kit.
Dude, I don't know what any of this is. I wasn't paying attention in the integrity training class.
Yeah, that sounds a bit expensive. I think I'll just train them myself. After all, this isn't rocket science.